AM 1430 KRGI, 105.5 FM. It's 8:42. I'm Brian Gallagher, a guest in studio from Central District Health Department. Carly Simonson is the Deputy Director for the department and here to talk about something that's really important. For some, it's been taken for granted, especially through the pandemic. But times are changing, and so this is important stuff. First, welcome back.
Good morning, Brian. Thanks for having me.
Let's talk about this because it involves Medicaid, and this is vital stuff.
Yes, absolutely. So we're here to talk about Medicaid Reenrollment or redetermination. Means the same thing. So let's start with a little bit of background. During the COVID-19 pandemic, Congress had enacted this Families First Coronavirus Response Act. What that did was included a requirement that all Medicaid programs keep people continuously enrolled through the end of the public health emergency. Well, here in Nebraska, our public health emergency ended on June 30th, which means that continuous enrollment for Medicaid also ended. So something important for our folks that are currently receiving Medicaid benefits, you will be required to re-enroll this year. That might be a process that you're not familiar with or haven't completed before. So we're here to help you with that.
Is it a difficult process, or is it just a matter of making sure details are right?
It can be a little bit of both, honestly. So Medicaid will send you a notice. What documents are, when your documents are due, what information they're needing from you, and also some different ways that you can apply or re-enroll. Important facts to note. So you need to make sure that your address is up to date in the Medicaid system, because that's where they're going to send all of your forms and your requests for information. So you want to make sure that you receive those in a timely manner. Those forms can seem a bit complicated, and that's where we're here to help. We have community health workers at the health department that speak English, Spanish, Arabic, and Somali that are very well versed in this process. They can help you navigate whether it's applying for Medicaid or even the re-enrollment process here. So.
See, this is important stuff, and they are there to help. So that's something that if you feel like, oh, this is way too hard, help is available, and it is important because as of June 30th, the status has changed. You can't just say, well, I used to be able to do this. You're right, you did used to be able to do it, but moving forward, this is something that's really important. Now, are there some specific areas that Medicaid is more important than ever in regards to coverages or the different types of afflictions that could affect all of our health?
Well, Medicaid, like any insurance plan, is giving you coverage for all of your medical necessities and your preventative care and things like that. So more importantly, what I want to focus on is there are some populations that are probably receiving Medicaid that we anticipate are going to be at greater risk for losing their coverage. So for example, if you have recently moved or if you've moved within the last year and your address is not up to date, you're not receiving the notice or the forms from Medicaid. Those also that have limited English proficiency, those forms and the requests that they're sending, like I said, they seem very complicated, so they might just push that off. Those are the ones that we really want to focus on and let you know that we are here to help.
Does this affect families of all ages?
It does. It does. So whether you yourself are taking Medicaid or maybe it's just your children that are enrolled in the program, every individual that is receiving Medicaid benefits needs to go through this process.
Simply put, Medicaid re-enrollment is going on right now, and it needs to be done to make sure there is no interruption in your coverage. If there is an interruption, it could be a very difficult delay.
Absolutely. Absolutely. We know that without having health insurance, preventative care, and then just minor things are very expensive, and that can be a huge burden on individuals and families.
If you have questions, you can go to the website, cdhd.ne.gov.
Absolutely, or feel free to give us a call, 308-385-5175, or stop by our office.
Carly Simonson, Deputy Director for Central District Health Department, thanks for the update.
Thank you.
Good morning from AM 1430 KRGI, 105.5 FM.